Hello, my name is Dr. Marvin Swartz. I'm a psychiatrist at Duke University Medical Center. So a psychiatric advance directive comes into use when a person with severe mental illness is unable to make or communicate mental health decisions. So in a state of agitation or confusion, they're not able to communicate reliable decisions about their choices for healthcare. So in other words, they can't give informed consent, and providers can't accept that as informed consent to authorize treatment. So what the Psychiatric Advance Directive does is it anticipates that there are crises like this. And so a person, when they've recovered from an episode of illness, can think about what happened to them, what they would like to happen in the future, and formulate a set of instructions for their future care. So there's two pieces to this. There's the advance instructions for mental health treatment, which is simply a set of instructions. Things like, if I get sick again and need hospitalization, these are the hospitals I would choose to go to, and these are the hospitals that I don't choose to go to. So these are consents to being voluntarily admitted. In addition, it could contain information like, these are the medications that work for me, these are medications that I'd rather not take, or even medications that I'm allergic to or give bad side effects. And then finally, it also includes a list of contacts which the person would like the treatment team to get in touch with. Now the second piece that can go along with the advance instructions are authorizations or permission to have another person who they trust come in and make decisions, confer with and make decisions with the treatment team. And so the job of that person, which we call a healthcare power of attorney or a healthcare proxy, is to have conferred with the patient, to have read the healthcare instructions, and use them to inform the treatment team about the things to which they will consent. So for example, they can put themselves in the shoes of the patient and say, yes, I consent to going to this hospital and I would like that to happen, or no, I don't want to go to this hospital, and say that in behalf of the patient. These are very important things because it allows patients to maintain control over their treatment and not feel as if people are doing things to them or doing things that they later regret. So it's a way for them to feel a peace of mind that when a crisis occurs, they still can maintain control over their treatment. Not infrequently, people with serious mental illness who come into crisis end up in a setting where their records are not available or the people that have been taking care of them are not available. And what a psychiatric advance directive does is it gives a very rapid communication about the person's treatment history, their diagnoses, the people who might be in contact with them, the name of their mental health team. And so in giving all that information that can be used in a crisis setting, it allows for continuity of care. So the person doesn't have to start all over again in this crisis setting because all that information is stored in the advance directive. So it's a rapid way to maintain continuity of care. So unfortunately, one of the things that mental health care teams have to wrestle with is confidentiality rules. And occasionally when a person with severe mental illness comes into crisis, they don't give consent or permission to speak to family members or important persons in their life, including their outpatient psychiatrist or mental health team. So what a psychiatric advance directive does is it provides a limited waiver of confidentiality. So what that means is it gives permission for the treatment team to call the people that are taking care of the patient and get information and confer with them. And that's very important at times when the treatment team otherwise might be in the dark. So there are a lot of great resources to learn more about psychiatric advance directives. There is the Crisis Navigation Project at Southern Regional AHEC. If you Google that, you can find it immediately. And then there are a lot of national resources, such as the National Resource Center on Psychiatric Advance Directives, which we house at Duke. There's also the National Alliance for Mental Illness, which is a very reputable national website that has tons of good information about the topic. There's Mental Health America, and there's the Bazelon Center for Law and Mental Health. All of them have really good information, so it's not hard to get up to speed about this topic.